Hello, everybody. My name is George Fielding. I am the Policy and Public Affairs Officer for Volunteering Matters. I'm here today with the planning group of the London Health Inequalities and Community Development Network, live in Southwark, central London, where we are meant to be and do the majority of our work in this great city. What is this network and what is the planning group? Well, this planning group has come together once a month for a minimum of an hour and organise quarterly events to bring together members of the community, members of our city, to discuss the issues that relate to their communities, from everything to the cost of living crisis to environmental racism, how basically communities, those on the ground, are being most affected by health inequalities, and what we as cross-sector professionals and organisations can do to most support them and champion their innovations into practice. And I am with the people, or a lot of the people, that have made this happen as part of the planning group today, all of which are passionate and do this work professionally and personally on a voluntary basis, because it is just something that they feel strongly about and need to do on a day-to-day basis. So, let me introduce you to my friends, colleagues, and partners on this podcast, this one-take podcast, but also who have seen this work through for many years. So, my friend.
Hi, I'm Jenny. I volunteer with my local church, St. Peter's Church, and Bouncers Road Neighbourhood Watch, and I also work for Edford Council.
Hi everyone, my name is Oksana. I'm the director for New Arrivals Support Community Interest Company, and my organisation looks after refugees and vulnerable migrants in London.
Hello everyone, I'm Deborah. I work within the Royal Borough of Greenwich in the Integrated Commissioning team, and my role is co-production and inclusion.
Hi, my name is Kush. I'm a social entrepreneur. I've got a portfolio career and I focus on making systems more inclusive for disabled people.
I'm Creamer, Senior Policy Officer at the Greater London Authority, the GLA.
Hello, my name is Kellyanne Ibrahim. I am part of the public health team in Royal Borough of Greenwich. My role is around neighbourhood development and inclusion.
Hi, my name is Jess Leach. I'm Community Engagement Manager at Southwark Council.
And I'm Naota Miller from Volunteering Matters. I'm the Project Manager and Facilitator of the network and the planning group.
So today we have been reflecting on all of our work, the 4 events, the culture, the methods of everything that we've done and all that we've achieved. May I start by asking my colleagues around the table why? Why was it so important to use collective action and come together to work in the way that we have post-COVID for our communities in London? What was so important and effective about the work that we've done over the last 2 years? Has anyone?
So this amazing network gave me the opportunity for wider representation of the community I represent and the challenges they face. Through our meetings, we were able to collaborate and co-design a unique working way that actually was so different to anything else I have experienced before. It was so effective that I felt empowered and understood and valued, and it brought really wide groups of people and groups of skills and knowledge and representatives from different backgrounds, but what united us, it was actually challenging the health inequalities of groups of people we represent here today. I felt that everyone in the group was equal, empowered, heard, valued, and all the opinions were respected. The participation in this network has been absolutely invaluable for me as a community leader and a voice for many. I'm hoping to replicate a lot of things I've learned in the network in the everyday work that I'm doing, and better the communities that actually are misrepresented and not heard, and their voices are shut. I'm hoping for the future, and for the knowledge that I've taken from this panel and from this networking group, to actually better the outcomes of the community that I'm here for.
Yes, so Jess Leach speaking again. For me, the reason why this has been such a valuable network is because it was really clear following the pandemic about how we were failing as a system, and the system that I was a part of, in really addressing health inequality. And I needed, through the work that I was doing, kind of engaging with communities and connecting with communities and supporting them accessing services, that I needed to think really differently about how I was working across, and my teams were working together. And the way to find that out is to come and to meet and be part of a group where other people are doing and sharing the practice that they're employing, so that I could see and understand how that work could be reflected in what I was doing, and therefore kind of improves the outcomes and the work of Southwark.
Kush, so the network replicated the wider system at large. We had people from NHS organisations, from councils, from civic organisations, and we had a shared vision and shared values in regards to health inequalities. And actually, also just honestly having the understanding that no one organisation knows the right solution to the systemic problems that we currently have. Being humble enough to actually admit that maybe then collectively as a system, we can find what's the right solution with the ever-changing and evolving issues that we have in our society, using the power of lived experience and really trusting the community to see what actually they answer to the current challenges that we have as a society.
I agree with Kush. I think it's really important not to be insular or siloed in the way you work. And so for me to come here is really important in order to not just deepen my understanding of my own specific area, which happens to be adult mental health, but other areas too, because everything feeds into our health and well-being.
As a network, we have run events in pretty much every part of this city, from Brent to Islington to Southwark, and we now have a network base of around 350 members, and there are around 20 of us in the planning group. And therefore, I am mindful that we had a challenge. We had a challenge to be truthful about the inequalities that our city were facing, the structural reasons behind those inequalities, the racism, the ableism, and the kind of lack of support for a lot of communities that are struggling in this city at this moment in time. The average adult kind of reading age is around about 12 in London. So we had this challenge as a network, whether or not it was spoken or not. It was definitely true that you can write about problems, but the more important thing is to actually action learnings and demonstrate the solutions to the problems that people are facing, because that is how, in my own personal and professional experience, that is how trust is lost in communities. Trust is lost because they see a lot of talk, not a lot of action. And people have very legitimate fears and concerns around how they are being heard and spoken of within systems and caught between systems. And as a network, the the responsibility, as far as I saw it, the responsibility on that was to provide that open and safe space within a community to have an open conversation, but also, as Kush has said many times, provide a magnifying glass upon the issues that actually never get discussed, from environmental racism to the cost of living, and therefore in alliance, as a wider network of 100 members, of 300 members, actually provide kind of unity and unison and solidarity to people in the city as a whole. Now, that, if I may say so, goes to kind of the how. How have we done our work? And so this is only one network. Of course, it's a wonderful network of great people doing good work. But how have we done this work? And what would we say and what would we advise people who wanted to be a part of it, set something like this up? What would we say to them to do?
So this is Kellyanne from Greenwich Public Health. I would say the collective approach and a safe space that has been created where different people from across London came together to have conversations and explore on different topics. And what's great about it is that there was no right or wrong answer. And it felt like a space where we were all equal. There was a certain democracy about the process where everyone have a voice in how this network was developed. And it's, for us, I would say there's been lots of learning on how this network has been developed. And I think for me, it's just having the different voice in the work and how we seem to intertwine and knit those voices together that helps shapes the events and the topics that we host each time.
Yeah, I agree with Kellyanne, and I think the diversity and variety within our group, in terms of personal and professional experience and backgrounds, was, provided something very rich for us to share. And I also think that what was really important was the way it was facilitated was very encouraging and nurturing and helpful, but it was hands-off in a sense. So we truly shared ownership of our network.
And I will add to that, for me, it has been a sounding board when I'm in a space with communities, development practitioners, because I'm seeing different tools and different ways of doing things, but it's also testing ideas that I bring from my local area. It sort of reinforced my confidence and instinct in the work when I'm working locally in Greenwich.
It's Kush again. So I think it's very rare to join a network where you have true kind of democratization and distribution of like equality and power. Lots of networks, a person looks at a person's job title and where they are in the hierarchy or where they are if they're a funder of an organization. And it wasn't like that with this organization. Everybody's voices was treated equally. And that's why I believe that this network was able to add so much value and to be so insightful. Because the issue is a lot of times when we have brainstorming sessions, if that's kind of biased in relation to a person's job title, we're never really going to have true a meritocracy. We're really not going to be able to value the best idea in the room and take that forwards. And we were able to do that with this network.
So that's how it's worked. But what have we learned from each other, from the conversations, from the events? Are there any key takeaways? Anything that we have learned as professionals and implemented in our practice within communities? You've talked about the importance of safe space, the importance of inclusive safe space, the importance of being aware of your own position and role within a room, and the power behind the kind of positions, and the need to be equitable in how we share power and position, and how we platform and share power with communities. I think Debs, you had your hand up as well.
Definitely, there's learning. There's been a lot of learning in different aspects to this learning, actually, and sometimes it's also the value of a question. There are things that have come up in these meetings that I've taken back and I've continued to reflect on. And there are practical things that I've taken from the sessions as well, suggestions of how you can do certain co-produced work. So that's a deepening of what I'm already involved with, and also the value of just meeting other groups and seeing what other people are doing in different spaces, and learning from that.
You've personally seen the legislative theatre and push for it to be used in other settings. Do you want to explain a little bit about that and how that came about in November?
Yes, I did. I thought so. I knew, obviously, I knew about this form of. Well, some people call it forum theatre, some people call it other things. Tony, I think, referred to it as just messing about. But it's one thing to hear a description of it and quite another to see it in action. It's very, very powerful. And so when the opportunity came up in another piece of funded work that I was doing to use forum theatre as a way of doing an extra bit of co-production, as another way of, relating to people, I did definitely endorse it because I'd seen it in action.
And so there is something that I think the legislative theatre demonstrated, which was that we've all got lived and learnt experience of many things, and we are all kind of complex beings, but there is a power to feeling comfortable within a method and having that method to perhaps kind of go beyond yourself and participate in a bigger piece, and a lot of this work often starts with that kind of with the ability to to let go and communicate your experience or your shared experience in another form. And I think that was incredibly powerful.
And walk in somebody else's shoes.
Somebody else's shoes.
Yeah, we've talked about, how democratic it felt in this group, and that was just another example of how you can achieve that, but a very great one.
But I also think having that space to do a lot of exploratory conversation made the network almost like creative thinking. Our creative thinking was even better because we were exploring and just tapping into each other's idea, and so it just made the whole space become a very much creative space for everyone to add conversations from their lived experience or their experience on the job.
It's like a musical piece from what you're saying. It's like we riffed off one another, and I think as I reflect on the work, we haven't stopped. One meeting a month, 4 events a year. We've always been moving, and that is something that I think communities respect, because we are there and it's immediate, and they get an honest and authentic response from the work we've done. Kush?
So one thing we learnt was this emergent process. So you mentioned previously, George, the analogy of we were like a magnifying glass, shining a light, focusing on different communities in different parts of London and being led by community organisations. We observed, we listened, we learnt from people's lived experience without any predetermined outcomes or bias in relation to leading a discussion, using the principles of emergence, true co-design, and co-production for community engagement. And this resulted in our events covering topics ranging from the cost of living crisis, co-design and co-production, youth isolation and mental health, and the climate crisis, focusing on black and brown men. And these weren't predetermined events. This was actually events that was emerged from co-designing and co-producing with the community. And it can be very scary to admit that I don't know what the right answer is, but I trust this aspect of emergence and the aspect of the community and the system to come up with the right solutions.
Mm-hmm. And because we've done it together, we've actually tackled those conversations head on. So it hasn't been, there's been agreement, disagreement, learning, and I think we, as you say, have embraced the messiness and complexity of this. We don't have the answers. We're humble, but the first and key step is to say somebody needs to tackle this, and we need to tackle it together. And to start the conversation is often the most important thing, especially if you are working with traumatized communities that are living with shame, hurt. There's a lot of things that get internalized and never talked about, and it is wrong. It's wrong, and sometimes far too easy to lean into that and just to brush things under the carpet. And as a practice and as a community, health inequalities get spoken about an awful lot. But anybody who has heard of Sir Michael Marmot knows that everything intersects and links together. So yes, you can legitimately be a specialist in housing, mental health, disability, all of these things. But it's incredibly important to see where the links are, to see where the agreements are, and focus on that and drive that home to the people in power, traditional power, that actually need to hear the solutions in communities.
And we also, just as Kush coming back, that the social determinants of health are the key drivers in regards to what's happening in regards to health inequalities. But how many times as a system do we actually have these discussions with the significant players in the system of actually how can we tackle health inequalities? These conversations are so critical at this point in time after going from 14 years of austerity, a pandemic, and a current cost of living crisis. There's so many community members out there that are not having their voices heard. And it's really important that now the time is that we do listen to these voices.
The work starts in allyship and by giving people the space to demonstrate what they know and how resilient and humble and how and the fact we've all got things to teach this city and our communities from migrants and asylum seekers, care experience young people with disabilities. We need to move away from the idea that everybody's lived everybody experiences the same, and that we have kind of an equitable practice and an equitable health system. There are so many things that we could discuss and do as a group, as a network, and this is work that keeps carrying on. We'll never die in its importance. But there is, as I think we've all demonstrated in this conversation, in this brief conversation, there's ways in which this is conducted and is truly trauma informed and can engage people, the people that most need to be heard, along the way. Be humble, be truthful, tackle the problems that most need to be discussed together. And with that, I guess I would say it's been a professional and personal highlight of mine to be alongside you in this journey, and so to thank the planning group, to thank anybody who partook in any of our events and discussions, and I humbly suggest that if there's anything that my friends around the table would like to say about the network and about kind of the work that we do and continue to do together as a collective, you can say it now. Gush.
I also just wanted to formally thank and give kudos to the Greater London Authority for taking the risk, quite honestly, to fund this network and the innovation, to Volunteering Matters for their great facilitation in regards to the network. It's been a true honour of mine and privilege to actually have been part of this experience and to experience true emergence, co-design and co-production with the community. And my hope is that this, the things that we've learned here and the processes that we've experienced gets replicated across the system so we can truly engage with the community to tackle the inequalities that are becoming, unfortunately, more and more pronounced in our society.
Yes, Kelly, and I just would like to add how it's just been the commitment of people around the table, the people who are still around the table going back from 2018 when we had the first masterclass training that brought everyone together. So it's just been just fantastic to see that sort of commitment. And just to add that Volunteer Greenwich, who took the mantle a couple of years ago, helped facilitated this event. Without the facilitation, I don't think we would be where we're at today. It's just been fantastic, the support and the coordination. So thank you, and thank all the planning members. It's just been amazing, and just amazed to see the richness and the diversity of London and faces around the table. Thank you.
I absolutely want to echo what my colleagues have just said, and it's been my joy and my privilege to take part in this and to share the space with all of you. It's been a rich learning experience, and I hope we keep going.
Thank you.
Well, thank you everybody, and thank you for listening.